So thank you very much for joining us today for our June webinar. And today we're looking at the effect of climate change on Reading's citizens and their health in particular. We're delighted to be joined by an eminent speaker and panel. So Professor Elizabeth Robinson, who's Professor of Environmental Economics at the University of Reading, will be setting the scene and going through the key findings from Reading Countdown. She has a degree in engineering, economics and management from Oxide and a PhD in applied economics from Stanford. She's also worked at the Boston Consulting Group, the World Bank and the Natural Resources Institute, as well as being a tutorial fellow at the University of Oxford. Her research focuses on climate change mitigation, systemic risk and health, oriented particularly around food security and food systems. We're also delighted to have Peter Moore and Rishi Madlani as our panelists. Elizabeth Robinson, as I mentioned, from the University of Reading, Peter Moore, who's head of climate strategy from Reading Borough Council, and Rishi Madlani, who we'd like to have, is head of sustainable finance and just transition for NatWest Group. He wears a number of different hats, and I'll ask him to each of our panelists and speakers to introduce themselves before their sessions. I'm Gupta Singh, and I'll be hosting the session from ethical ratings point of view. So what is ethical rating? Just a couple of minutes on that. We are a fairly new, not-for-profit social enterprise. We launched in 2018. We're registered as a community interest company. Our mission is to embed ethics into the workplace and broader into the environment and in the community. We want to inspire, educate and collaborate. Those are our core values. We have over 45 partners and supporter organizations and a growing set of individual members and followers. And we hope, if you enjoy what you listen and see today, that you will join us as well. We have over 20 volunteers. We're entirely volunteer-led, and we hope that what we're doing in Reading will be the start of something broader. What we hope is an ethical cities movement around the world. So with that, I'm going to hand over now. I want to stop sharing my screen and hand over to Elizabeth.
Excellent, thank you. So thank you everyone for joining. Well, thank you to Ethical Reading for inviting me, and it's great we've got two panelists to talk about this work. The idea to do what we've called this Reading Countdown came a few years ago when I was talking to Ethical Reading and wanting to get a bit more involved in the town. I work at the university, but I wanted to be more involved. I think my only proper involvement before that had been to run the Reading Half Marathon when I first joined the university as my sort of first commitment to the town. So this was my second sort of what I hope big commitment to the town. And yeah, we were sort of chatting and I thought, we're doing this big global report on how climate change is affecting human health at a global level and with big global numbers. But I was thinking, it's just as relevant to Reading, and a lot of the work that's been done by Ethical Reading, by Reading Climate Action Network, was linking to this also. So I thought, what if we did a sort of proof of concept that we could do, just as the Lancet Countdown is going down to the town level and Gurpreet wants to take Ethical Reading to a global cities, I thought let's take a global initiative and try it out. And no one's tried this out at a city level. And Reading's doing so much in terms of this commitment to climate change mitigation and dealing with adaptation. I thought this would be quite exciting. And then I got a little bit of funding actually for 2 undergraduate students to work on this. So a lot of this work is by 2 undergraduates, and it was their summer project with me. And then the other 2 people who've done a lot of work on this are Dr. Claudia Di Napoli, who's a research fellow at Reading. And I hate to say what she's an expert on because I get it wrong and she's in the audience. But anyway, she's a fantastic scientist who's looking at heat and heat stress globally. And I asked her to zoom in on Reading and help us with that and the rest of the report. And she's also a Lancet Countdown co-author. And then Dr. Shura Dasgupta, I think he's in the audience too. And he's working on the health data and admissions data. I also think why it's interesting to be looking at this now is I think we're all really, really sensitized to this idea of pressure being put on our health services. So with COVID, the narrative every day on the news is, yes, it's numbers, but it's also, what do those numbers mean for pressure on our health services when it comes to opening up the economy? And as I keep saying to people, you know, we can vaccinate ourselves, which is fantastic, but there's no vaccination against climate change. So it's very hard to reverse. And, you know, as it hits us, getting on a better track gets harder and harder. And one of the things it's going to do at a local level is put pressure on our health services. And so we thought it'd be nice to try and track at the local level the pressure on our health services and what we think might be tracking, and where that what we think might be affecting, putting pressure on our health service in terms of climate change comes from work we're doing trying to make those links between climate change, risks, exposures, vulnerability into the impact on our health, and then that puts pressure on us to on the National Health Service. So that's where this comes from. And at the moment, what I want to say is we're not making attribution at the moment. So we're not saying that climate change is causing this impact on health admissions and the health profile of people in Reading. But we want to do that in the future. At the moment, we're finding indicators that we think are useful to track over time that will give us a sense of to what extent Reading is feeling the pressure from global climate change, and to what extent Reading is going to be under more pressure because of existing pressures on the health service, and to what extent there are things that Reading can actually do and we're looking for those co-benefits where it can reduce the pressure on climate change at a global level by reducing emissions and reduce the pressure on its health services. And as I say, a lot of people are looking at this in Reading. What we're not trying to do is reinvent the wheel, but find a way of engaging and presenting our data. So in the next sort of 10, 15 minutes, I'll just show you some of what we're doing. And sure, we'll talk a little bit after that about just how hard it is unless we've got the right data. So just finding my mouse again. Yeah, so there's 3 questions, although there's 4 questions now, but there's 3 sort of questions we asked that we've put into policy briefs that are now available. So the first question is, can we pick up from the data that climate change, global climate change, is actually affecting Reading? And if so, how? And then we asked ourselves, is Reading taking notice? Well, we know everyone on this call is probably taking notice on this webinar, but are our politicians taking notice? Is our media taking notice? And I'll just say, when we look at that, these were completely innovative ideas from our undergrad students at Reading. So they had the ideas, they designed the indicators. So that's quite exciting. And then we asked another question, is Reading taking action? So we can look at those kind of activities that Reading's undertaken that reduce emissions, benefits the world, but also reduces the kind of things that harm Reading health. So it's local benefits. Because of course it's great that we're mitigating climate change, reducing our emissions and helping the planet. But the reality for Reading is the real benefits are when we can show that we're both reducing emissions and improving the health profiles of people in Reading. And that's where the sort of cost benefit at a city level or town level, when you're cash strapped anyway, really matters. And then we'll start to look at what the impact on health and health systems might be. And as I say, it's early days on this part, and in part because when we first started this project last year, we sort of envisaged, you know, all the hospitals wanting to chat to us, having time to chat to us, talking to public health people. COVID came, and of course, dealing with COVID is a little bit more important than our project. So, so we still believe actually that as we get on top of COVID, that I think there will be this, hopefully, this real interest in, gosh, you know, there really is increasing pressure on health services. It could be from the next pandemic. It certainly will be from climate change. So first of all, Reading is warming. So these are the data. We have the data. There's plenty of monitors all around to find the data, but Reading is warming. These are the data. Of course, average temperatures fluctuate each year, but the trend is very much upwards. Also, the number of heat wave events by decade for Reading is increasing decade by decade. And although it's really raining today, I think, you know, we have experienced extreme heat once again, and more records being broken once again in this last decade and in these last years. So this is quite it's quite interesting, you know, it's quite a noticeable trend in our lifetimes and more worrying in our children's lifetimes that already these trends are visible. And here we have some data on the number of heat stress days in Reading. And heat stress days are particularly problematic. The heat stress undermines our body's ability to maintain its core temperature, and the most vulnerable people are likely to be affected. Older people are likely to be affected, people with pre-existing conditions. So one of the things we want to monitor is how many of these kind of vulnerable people are there in Reading? Because if the number is going up, then climate change becomes a sort of amplification of the pressure again that's going to be put on the health services, but also that people are going to suffer more ill health because of that. So, you know, we care about the individuals, of course, and the pressure on the health services, because any pressure on the health service due to things linked to climate change means less health services available for other things, like caring for the elderly, people with cancer, all those other diseases that are not linked to climate change. So we asked ourselves, is Reading taking notice? You know, is there a buzz? Are people talking about climate change and health? And so what we've tracked, we looked just at Reading Chronicle. Again, we're low budget and just 2 undergrads doing this part-time in the summer. But, you know, it's fantastic. One of our students went through every single article in Reading Chronicle that mentioned climate change. And then he looked at those to figure out whether they really were talking about climate change, not a jazz band called Climate Change, and whether they were talking about health explicitly or whether implicitly. And what we can see is that there's an awful lot of talk about climate change in 2019, 2020. And that's really the Greta effect, Extinction Rebellion, and Reading Town declaring a climate emergency. So that's great. And we see some of the data carrying on in 2020. In 2021, it'll be interesting to see what the data say, because we've got COP26 coming up in Glasgow, but we've also got COVID. So, but what we're really interested is in this tiny little green line creeping along at the bottom, where there's explicit discussion of climate change and health. Not a lot of that. And then we thought, what about our politicians? So we tracked all the Berkshire politicians, and we actually have some big name Berkshire politicians, which is nice. So we're hoping, again, we understand people are distracted by trying to, deal with the reality of COVID and the horror of COVID, but we're hoping at some point we can engage with some of those individually. And here again, our other student, he designed this indicator himself, and he did it. So he painstakingly went through every Hansard speech that our Berkshire politicians had undertaken, and if they mentioned climate change, and then if they mentioned health, and then he had to figure out if they were mentioning health explicitly or implicitly. And again, the green line is the one we're interested in. Are people really talking about the links between climate change and health? And he found precisely 3 mentions. One about a bridge in Reading across the Thames as an example of encouraging walking and cycling. So this idea of active transport. So we get healthier by walking and cycling. And also if we're doing that instead of driving our combustion engine car or any car that causes congestion, then we're also reducing emissions, and that's a co-benefit. So we can say it's a co-benefit of health or co-benefit of climate change, but it's a win-win either way. A green flag winning school in Maidenhead. So that's really exciting to see schools getting engaged and involved. And an increase, there was, okay, so this was a negative, an increase in driving due to a decreased train service in Maidenhead. And there we can see that, there's government policies in terms of supporting public transport. And when those services go down, driving goes up. And therefore we're having more people just getting straight in their car, so that they might be less healthy before, rather than say walking to the train station, and more emissions if they're getting into a combustion engine car or if they're causing congestion. And I'll just say, when I say all this, I know there are some people who have to drive, but for many of us, we don't have to. So I'm not suggesting that everyone should jump out of their car, but what I'm saying is for those of us who can, there are win-wins for our own health, for the health of Reading, and taking the pressure off the health services in the long run, and mitigating climate change globally. So there's lots of benefits from our individual self through to the planet. So then we asked, is Reading taking action? Can we pick up in the data good things, good news about emissions? And we certainly can. So we can see that Reading reduced its CO2 emissions by 46% from 2015 to 2018. And if we actually look on the top graph, we can see that England's doing better, Reading's doing better than England overall. So that's really good. We can also see that more generally, when we break that down, though, transport-related emissions have only fallen by 18%. And so if we think about the emissions that benefit the planet, which is switching to renewable energy, for example, and the emissions that benefit Reading, which is reducing transport emissions, we can see that Reading is contributing to global climate mitigation, yay Reading, but it's not doing what it needs to protect its citizens so much. And so what we can see is we can sort of start to pick that up in some of these other data. So the top graph shows concentration of PM2.5, and that's those tiny little particles that get deep down into our lungs and cause a lot of disease. And we can see that, and there's something strange about the data in 2015. We have double, triple, quadruple checked the data. So the data point in 2015 were often not sure what's going on there. But if we look at trends, we can see that PM2.5 was falling, then it seems to have crept up. And if we actually look at fraction of mortality that we can attribute to particulate air pollution, we can see it looks like that has been creeping up as well over the last decade. So that's something for concern. And the nice thing about indicators is, in a way, all we really care about is, are they going down, up, or leveling? And we can traffic light those. So something that's concerning, we can traffic light red, and something that's positive, we can traffic light green. And then, you know, as policymakers, one can look at why it's happening and how one can actually try to influence whether something's a graph is sort of, you know, trending upwards or trending downwards. So perhaps a particularly concerning trend is when we look at nitrous oxide and when we look at ozone. So what we know is that NOx, NO2 concentration is heavily linked to fossil fuel powered engines, and ozone is formed, and I do have an engineering degree, but I'm not a scientist anymore, but ozone is formed when nitrogen combines with particulates and other gases. And it looks like concentration of ozone is starting to creep up. Concentration of NO2 was falling and now is leveled off and maybe creeping up. And Reading's doing a little bit worse than all sites across the country. So again, this is one of those areas where we might want to feel concerned. And that's a point where the next step really is to say, okay, why do we see these trends? Because it's only if we understand those trends, we can start to think what the interventions might be. But what I want to say is there's many positive efforts to reduce emissions, improve local health, and reduce pressure on health services in Reading. So if we look at the investment electric car charging infrastructure, it's better than the England average. If we look at use of public transport, bus journeys in Reading have increased compared with a fall across England. So these are really good stats. It's not just that Reading's doing well, but they're doing better than average compared with the country. Other initiatives, bus fleets have included 62 biogas-powered, 21 hybrid buses. But, you know, if we temper that, there hasn't actually been a change in numbers engaged in active transport like walking and cycling. But what we can see is there's many benefits for this climate health win-win at the local city level. Of course, a lot of it is about transportation and active lifestyles. So the transportation, active lifestyles, we're reducing emissions, but also sort of just getting healthier, again, is taking the pressure off the health service and reducing the likelihood that we're going to need to be hospitalized because of events due to climate change, such as heat waves and heat stress. In terms of the health data, they are a little bit mixed. I just have put out some slides here. So if we look at total hospital admissions in Reading, they've increased. So in general, there's increasing pressure on the health services. These data are pre-COVID, by the way. The data will look very different for 2020, 2021. If we look at things like hospital admissions for asthma, which we know is linked to climate change and air pollution. So the air pollution combined with heat and heat stress can make asthma attacks worse. And of course, the very sad story of Ella Kissi-Debraj in London, who had an asthma attack that now has been proven to be worsened and precipitated by a combination of air pollution and heat, or certainly air pollution. And we know that, you know, these are real harms due to air pollution, real harms due to heat. And we can see that asthma, hospital admissions linked to asthma in Reading have increased. if we look at this, and I think that's the admissions rate for asthma. So what we've got here on the data, we've got also like another way of looking at the vulnerability of Reading or the exposure of Reading Health Services. So if we look at the total population of Reading with diabetes, that's been increasing over time. So not all these data have to be to do with climate change or to do with air pollution, but the idea is that in many ways, there's increasing pressure on the health services in Reading, such as a high proportion of elderly people, a high proportion of people with diabetes, and we're seeing the high proportion of people being admitted to hospital that may be linked to air pollution, that may be linked to heat, and that's kind of the next steps we want to do. And here's another graph where we're not suggesting causality, but if we track prevalence of cardiovascular disease in Reading, it was falling. So the number with cardiovascular disease, it started to increase. We don't know the cause at the moment. We can find it out. But we've also noticed on the right hand that if we look at, this is a hard graph to explain. If people want explanations, Dr. Gupta can explain it. He's going to talk later. But again, what we've seen is a fall in the prevalence of extremes of heat and cold until 2010 and an increase. Now, these graphs look similar, but like I say, there may be a completely other reason why they have a similar shape. But it's something that says maybe we want to look into this, maybe want to explore whether this prevalence of cardiovascular has anything to do with climate change, or it might just be to do with an aging population, a less healthy population. But either way, we know from the science that heat will put more pressure on people with cardiovascular disease. So either way, climate change is going to make things worse. And finally, just to say, sometimes the trends are positive. So here, if we look at chronic heart disease admissions, in Reading, they've actually fallen over time and relative to England as a whole. So there's some data there that's actually bucking the trend, which is nice, a negative trend in terms of admissions. So I'm just going to invite Dr. Dasgupta just to talk a little bit about these links between climate change, health, and hospital admissions and mortality, morbidity. Sure, are you there?
Hi. Yes. Hi. This is Shoro Dashgupta. I'm based in the Euromediterranean Center on Climate Change in Venice, where it is very, very hot today. Thank you, Liz, for the great presentation. I just have a few points to add to Liz, and she's put the whole story wonderfully for everyone. So as Liz mentioned, total hospital admission has increased, right? So we're seeing that asthma, hospital admission and emergency admissions related to asthma has increased in Reading over time, right? So this already is putting additional stress on the public health system in Reading or in Berkshire, if we want to be more precise. In parallel, we have also seen the prevalence of the diseases that we generally link to heat or heat stress, including cardiovascular diseases and diabetes, have also increased over time. A little more numbers, right? So in terms of mortality or rate of mortality, respiratory mortality has increased by 3.4% over the last 10 years, right? Communicable disease-related mortality has increased by 5%, while chronic kidney diseases have increased by 1.5%, right? So all these three are very closely linked to heat stress. In terms of prevalence of diseases, which also puts additional stress on the local health services, hospital admissions due to respiratory chronic obstructive or COPD and asthma, as I said, have steadily increased over the last decade. In terms of demographics, currently 12.5% of the Reading population are 65 and over. By 2041, which is in only 20 years, this will increase to 17.5%, right? So in 2 decades, we're going to see an additional 5% of Reading population being 65 and over. And so we have plenty of literature which shows that elderly need more healthcare, and so this will put additional stress on the health system. So this is a double layer of stress, right? So you have the climate-related stress, which we are already seeing, and then the disadvantage or the negative impacts of losing the demographic dividend, right? Putting all this together makes will likely make it more difficult for Reading and Berkshire to improve its overall health outcomes. And this is why we need to understand and establish causality, as Liz mentioned, between climatic stressors, so it could be heat stress or cold stress, and the health-related outcomes that we're following or tracking in Reading, whether in terms of prevalence of diseases, whether it is hospital admissions, whether it's mortality. But we need to establish this causal outcomes so that tailored policy, especially in terms of adaptation or co-benefits, can be achieved. Before I always end with a rant generally. We really need to note that the inconsistency in data coverage is a barrier to tracking climate impacts on health, especially at the town level in the UK. Just for Reading and Berkshire, data availability varies between town, county, unitary authority, clinical commissioner groups or CCG, hospitals. I mean, seriously, we need to get our game together, right? This is about data. This is not that difficult. We need to stop this. Who's got a bigger budget and who's got more influence in terms of holding data, and just share the data with researchers. I mean, take out the identifying information and make the data free. There is no point holding on to this data and not taking advantage of this fantastic university collaboration we have out there. That is to say, with data coverage, Reading and Berkshire are no different. And that ends the rant. Thank you very much.
Thank you. And that ends our presentation. So thank you.
Fantastic. Well, thank you very much, Elizabeth, and thank you very much, Shoro, for bringing the results to the audience. Some very interesting information and data there. And I'd like to turn now to Peter Moore, who's the head of climate strategy at Reading Borough Council, to give his thoughts on that. Peter, there were a number of things that were mentioned there, and as Elizabeth was saying, there have been some really excellent improvements, for example, in CO2 reduction over the last few years. What are your thoughts on what Reading is doing now, and what are the plans for the future?
Thanks, Gurpreet. Everyone hear me okay?
Yep,
thumbs up. Yeah. Great, thank you. Thanks, Gurpreet, for inviting me along to sit on the panel, first of all, and thank you, Elizabeth, both for that presentation and also for, I think, really bringing this issue of the connection between climate change and health to the fore. I was struck by the graph you showed with the relatively small number of media articles that are making that connection explicitly. And I think if we could make that green bar on the chart a bit bigger, I think that could be one of the keys to maintaining and sustaining a very high level focus on climate change in the public debate. Because while lots of people care about polar bears, they're sort of far away and not everybody cares about them, whereas everybody cares about their health, everybody cares about the NHS. So I think more power to your elbow actually in pushing this agenda. And I think we've tried our bit through the Reading Climate Emergency Strategy, which we adopted with our partners in the Reading Climate Change Partnership back in November, which has got for the first time its own action plan devoted to health and well-being. And it tried to indicate through that we see this as an important and growing area of debate as well. A few reflections, though, on Elizabeth's presentation. I suppose picking up from our colleague's rant there about data, data lag in a fast-moving world is always an issue, isn't it? So I was chuckling, Elizabeth, at the metric of how many times the MPs reference an issue as a good measure, as a good measure of anything, really, with all due respect to them. But I suspect if we did that right up to date, since Alok Sharma was appointed to preside over the COP26 talk, he's talked of little else but climate change, and we'd have a massive spike in that graph. More seriously, perhaps, we've had this little thing called the pandemic, and some potentially game-changing impacts, which are perhaps not reflected inevitably in the data that Elizabeth presented, which in a lot of cases sort of brings us up to 2019, but not beyond. And we're still waiting for some of that data to come through. But it kind of creates a lot of uncertainty about where certain trends are going to land, doesn't it? So just a few thoughts on what we think we know at this point. We know that traffic plummeted Not surprisingly, and air quality improved during the harder lockdowns of the last 18 months or so. But we also know that even with higher and sustained levels of people working from home, traffic and air quality problems rebounded depressingly quickly. I think we can agree, as partly because public transport use continued to be discouraged and remains well below pre-pandemic levels. Chatting to my transport colleagues this morning for a bit more up-to-date insight, they said that they think they're seeing the peaks of air quality problems perhaps becoming a bit less peaky, but also a shift in the peak away from the commuting peak to a school pick up and drop off peak, which is really interesting and obviously has implications for the focus of our interventions going forward. And things like our school streets program, which we're very committed to, becoming relatively more important in terms of the package of measures that we can promote as a local authority to tackle air quality. We are sadly seeing public transport use way down. I think rail is recovering probably a bit better than the buses from the last data I saw. I guess the worry with bus services, Reading's brilliant bus service is sustained by high levels of usage by office workers coming into town during the day. The working from home improvements suggest that might become a longer term trend, and there is a risk there of you can imagine the sort of vicious spiral of reduced ridership, reduced services, which we're obviously very keen to avoid. But I think we need to be honest and recognise that is an issue and a threat. More positively, cycling has undoubtedly increased. I haven't got a data point I can point you to, Elizabeth, for local to prove that locally, but certainly the national evidence is that there's been a big increase in cycling, and I think we can reasonably safely assume that also applies in Reading, and some of the short-term and medium-term steps being taken to improve active travel options should help ensure that becomes a sustained change. I think there are challenges for my colleagues in the transport planning world at the moment. On the one hand, there's that desire to move really quickly to lock in the positive changes and the positive behaviours that we've seen adopted over the last 18 months. But at the same time, there's a kind of need to sort of pause for reflection, see where some of the trends land, whilst recognising that obviously action we take now can help shape where they land. Some of that will be beyond our control, and that's kind of led to a little bit of uncertainty about where we go next with some aspects of our transport policies. And while if traffic and air quality bounce back in a bad way to the pre-pandemic levels, intellectually that doesn't weaken the case for sort of demand management interventions, things like clean air zones, which a lot of local authorities are looking at. The sort of harder end of demand management for urban traffic. It does kind of complicate the politics of it, because we've got businesses saying we're on our knees trying to recover from this pandemic, and therefore the kind of political support for the more sort of radical demand management options is potentially harder to sustain. I think just finally worth saying, active travel, all the first tranche of schemes were done at a rush, at a bit of a canter, didn't all go brilliantly, not just an issue in Reading. I'm sure that's an issue for everywhere else. The second phase, which are in consultation at the moment, if you go to our website, you'll see some really ambitious schemes being put forward there, perhaps being done in a slightly more considered way, and really could have a major impact on future prospects for active travel. So I think if my colleague earlier said he closes with a rant, I always try and close with a few sort of optimistic thoughts about the future. I think the active travel agenda is heading in the right direction, and we're putting infrastructure in place to lock in the benefits of that. We're looking at a town centre strategy development process in Reading, where the discussions that I've been part of, which we broadened out and probably involve more of the people on this call in the coming months, there's a real increased focus and energy around how do we break the stronger hold of the IDR in terms of movement in and around the town centre, which is very good to see. And I think the government is very concerned about this whole obesity epidemic, and I think getting people out of their cars, getting them adopting more active modes of travel is actually seen more than it ever has been before by government as part of the answer to that problem. And that's a very good, in one sense, a healthy dynamic, if I can borrow that phrase, to make sure that policy and hopefully the resources to deliver it are heading in the right direction at the moment.
Brilliant. Thank you. Thank you very much, Peter, there for your initial thoughts. Clearly, I think the areas around the topics of active transport and mitigating the effects of climate change are very important, also near and dear to Ethical Reading. So some of the things we're doing there are encouraging cycling through, and we have an initiative around cycle security there. And we're actually talking to your colleagues at the council around potentially having some cycle hubs where people can leave their bikes securely once they go about their business. And of course, in terms of mitigating the effects of climate change, we have an initiative around trees for Reading. So the whole greening of urban areas is very important. I want to turn to you now, Rishi Madlani from NatWest. You're the Head of Sustainable Finance and Just Transition. I'd love to get your thoughts in terms of the role that you see here for NatWest and banks in general, in terms of encouraging the move in the right direction for both citizens and business.
Brilliant. And firstly, thank you for inviting me. And it's lovely to be virtually in Reading, even if I haven't moved from my desk in London today. And it's nice to get around the country, because for me, this is actually a really good sign. Meetings like this happening around the country where local climate action is being talked about is vitally important. So as you introduced, my day job's head of climate and sustainable finance at NatWest Group, where our CEO last year put climate at the centre of our new purpose-led strategy alongside enterprise and learning. This has meant my job has fundamentally changed from being an internal campaigner, agitator, trying to get people to take climate to the top agenda, to now having to deliver some of the biggest challenges of the climate crisis. From commitments as halving our financed emissions by 2030 in line with the Paris Agreement, committing to a net zero by 2050. These are targets that are actually really, really difficult. And we talked about data a bit today, a lot today. And actually the fact that we don't have this data in decent size is where I think banks can play and financial services can play a huge role in helping to collect the emissions data, help to understand this data. But it's people like Elizabeth and her team and Shura who've done great analysis of this, of pulling together all this data. There's a lot of data available. There isn't a strategy through that. To decarbonise our balance sheet by 2030, we need our customers to decarbonise. It's not about NatWest per se. It's actually about how do we help that real economy decarbonise. So through that, some of our other work, we've set up our regional climate leads network. So this is one of the first events we've done since we've agreed to do since then, is actually how do we take local action? And this involves investigating some of the problems and solutions. So what I hope to do in the next 3-4 minutes, I want to make sure we allow enough time for questions, is tackle some of the issues that I thought came up from Elizabeth and Peter's excellent response here today. So firstly, let's just set the context of where boroughs have been. After 11 years of austerity, we've seen what's happened to local government finances and what's happened to particularly sustainability and climate departments over the last 11 years. So we have to understand that context. What's refreshing for me and what's reassuring for me is people like Peter now, we're having climate emergency plans, the response, the officer and borough level responses to what is a climate emergency and that recognition of that. It's still sometimes a bit not clear what, there are a couple of boroughs still recruiting for climate emergency officers 2 years after they declared them. Barnet, my neighbouring borough, doesn't have a climate emergency. So does the climate end at the borough boundary? I'm not sure how that quite works, but you take the point. And what really makes a difference, and what I've seen learning from the bank, is actually setting that into your strategy. So the Camden, for example, that's now into our constitution. Never fun changing a borough's constitution, but putting climate into every decision actually forces that discussion to have. So rather than it just having to be we can't always rely on, I wish we could always rely on our political representatives, but as we heard from Elizabeth's presentation, they're not making these points on climate. They're not informed enough yet, and I think this is why Ethical Reading exists, to make sure that people are informed and asking the right questions. So to bring it specifically to, I think green jobs and the recovery from pandemic will be absolutely key. So thinking around what aid we give to companies as local boroughs as we return to work. how do we tie those to climate-related pieces? So if we're giving streetery permissions for people to open up restaurants, how do I make sure they're not putting out gas heating stoves on those? How do I ensure that the travel plans and the way they attract their customers is about active travel? Is that someone's jumped ahead of my thinking on this? How do we measure these things and the impacts of air quality on encouraging people as the economy regains? We really need to think about this more deeply. Linking that to, I think there are 3 key areas for me that came up from that, and that I think are 3 key threads. What councils and what we can do, and what local working together we can do around buildings, transport, and buildings, transport, and engagement. On buildings, thinking about every capital budget that Peter's colleagues have, every council property, every retrofit, every bit of work that's happening in the next 20 years has to have a climate angle on it, the long-term thinking of this. Because the key thing for me on this is, and where the bank can help with our green mortgage product, for example, that we launched for already A and B rated energy efficient products. We'll be launching a green plan later in the year to help customers. We've already got advice to help individual retail customers to map their carbon emissions. We've got a pilot with Kogo. But actually what we need to do is help those, and local authorities and communities have a role to help those who are least able to afford to do so. So what do we do for the fuel poor? What do we do for those who can't afford to help improve their own homes? Now, is that housing associations? That's council's responsibility, but also what calling for where our budgets go there. The second piece is on transport, and I think Peter touched on it very diplomatically. You know, the political leadership that needs to help shift this has to be consistent and clear. It has to be walking and cycling first, active transport absolutely first, and not move from this. There will be individual schemes, individual bits will create political pinch points and pain points, and that's the nature of these things. To make progress, sometimes we have to smooth over a few bumps, and that's where it takes political leadership. Your 8 MPs across Reading, your Reading Town Council needs to show that consistency of leadership. So Peter and team can actually think about this. Your active transport folks can actually implement this, and then we can start seeing the those impacts on air quality. And I think that I believe the public is strongly behind this. It's a vocal minority who try to disrupt this. And that final piece, because I want to end on optimism, because Shora's rant was a nice way, but I like to end on a positive. So I've got 2,000 young people in our Sustainable Futures Network at NatWest. I call it Building My Climate Army. I've sent 1,300 senior leaders through the Cambridge Institute of Sustainable Leadership and University of Edinburgh, and obviously colleagues at the University of Reading and other universities are brilliant as well. And you know, there's plenty of education to be done, so there's plenty for everyone to do. Or whether it's our Sustainers School Network at Camden. Before the lockdown, remember that I loved Elizabeth's work, the Greta effect, because that really struck me. That was what we were seeing. That's what our kids were doing. Our children were out protesting, and we were seeing that impact. How do we then take that energy back as we return to normality and return? It's there. It's tapped on. It's under. It's not necessarily. It's not. It's there in the public, and we can see that from the YouGov longer-term polling of where climate is ranking as a public issue. It may not be reflecting itself in our political leaders, but then that's our job to make sure we either change our political leaders or make sure they get it onto their agendas. You know, yesterday's by-election result showed another big surge for green. So we want to see more of that. We want to see more of, you know, this is clearly something that's come from the local elections last time round. How do we make sure that feeds into green policies? Because, you know, actually that's what matters, not the colour of politics. I'd just end on the positive was our climate assembly, Camden. I was a bit cynical about it. It was well written up in The Guardian, so if anyone hasn't seen it, please do have a good read there. And I was a bit cynical as someone who's spent the last 15 years of my career it's focusing on climate, financing wind farms and things like that. I was like, okay, what's going to actually happen with getting a bunch of effectively random strangers together? And actually, what I really loved about it was it helped co-create, got the public's engagement, that helped direct that public energy and passion, connecting that to councils and local players' involvement, and really brought communities together. And I think that's what we really need to do. We need a few more diverse voices on this. When a COP team was initially proposed as an all-male COP negotiation team, I wasn't impressed. I'm glad Alok's involved now as well to see some people of colour. But we need to challenge some of these big points. But I want to allow for questions, and I hope that's a helpful addition to the discussion.
Super. Thanks very much, Rishi. A lot of interesting points there. And I particularly like the one around the Citizens Assembly. Perhaps we can come back to Peter around that. and have a kind of local one around Reading, around some of these topics. But I'd like to open up to the audience now in terms of questions. So if you have a question for any of our panelists, please do unmute yourself and ask the question. And if it's if you want to direct it at a particular person, do so as well. Don't be shy. If you'd prefer to put the question into the chat window, feel free to do that. So here's a question from Alex. How is NatWest pushing investors towards companies that are playing a material role in reducing their emissions of themselves and of their supply chains?
Great question. And this is absolutely the key, is because actually we have to realise our key role is moving the real economy, and that's how we will tackle climate change in the UK's commitments. So I'll start with the optimistic this time and end with what the challenge is. On the optimistic side, so I first started, we recently issued one of our first NatWest Bank green bonds. We've got a green, social and sustainable bond framework. I have a look at it if you're interested, because it's actually quite a unique. The social bond framework particularly has starts measuring job impacts. It's quite a trailblazing aspect. But this has really shown us what that level of sea of capital is out there. There are a number of ESG investors, the number of mainstream investors, the amount of money that's available for these schemes. In this year to date, 8% of bond issuance is now green, social, sustainability linked, which compared to when I first started in that sector 5 years ago was a fraction of 1%. And I wouldn't get my markets colleagues' time at that time. Oh, you're a niche market. So my reason for optimism is that the capital flows are going there, and companies are realizing this and are seeking that capital. Similarly, stuff on pension funds, you're seeing this transition. We all need, as individuals, need to put more pressure on our fund managers and our investments to do this, also through the council pension schemes. The less reason for optimism is I feel that there's the top 5-10% of businesses are the ones making the noise and are the ones we hear from the most. And the bit I worry about every day is the 90% of businesses who haven't started this journey, who aren't doing anything. And we've got some thoughts and some ideas, and maybe closer to COP you'll see a bit more of this, but we actually need to move the whole economy. It's no good focusing on just high emitters on one end, or the companies who want to share their green credentials the most, because that is the people who are issuing some of this and attracting the lower capital. But we need to move the whole economy. SMEs and tackling small businesses, which will be the key to Reading's recovery as well post-COVID. As we get people out back working, SMEs will be that engine for growth. How do we make sure that they are thinking around this and building climate into their plans? And this is a real challenge, and hopefully we will be able to help with some more of that data, with more to come with our partnership with Microsoft later in the year.
Super. There's another one that's come through the chat box, probably more in your sort of area, Peter. How has Reading done, or suggestions of other good models you may have looked at around equality impact assessments as part of developing strategy and outcome indicators for your plans in this area? So how do we compare? And are there other good models that we could potentially learn from?
Yeah, it's a good question. I think, at the strategy is reasonably high level. I think the important thing that's in there is that recognition that the costs of tackling climate change, can't all be loaded on the people who are least well equipped to bear them. So that idea of a just transition is very much a core principle of the strategy. I think the application of the specific equality impact assessment probably comes in down the chain at the level of specific interventions and programs as they're sort of rolled out, rather than at that sort of highest level. But I think you can be reassured that the partners in Reading are very mindful of that issue. And Reading's a town with massive inequalities, which are often sort of masked by the perception of it being a sort of wealthy part of the country. Certainly very much in our mind as the local authority. I could pick up that separate question, Gupta, if it would be helpful, about Citizens Assembly.
Oh yes.
Because I think a bit like Rishi, used to be cynical about it. I think was really impressed by the national Citizens Assembly and the outputs from that, I think the only thing holding us back at the moment is probably, in my case anyway, a confession, not having the resources to do a proper job of it and not wanting to do a rubbish job of it. Though there is a piece of work that the Thames Valley Berkshire Local Enterprise Partnership has commissioned to look at sort of gap analysis across the piece in Berkshire. And it might be that, by clubbing together and doing something at a bigger scale, we might be in a position to look at that or indeed other better ways of kind of, bringing people into that discussion. But no issue with that in principle. But right now, wouldn't want to go off half cock with something that's potentially so important in sending us in the right direction.
I'll just help Peter out there because I'll invite him if he's not already a member of the Place-Based Climate Action Network that's sort of ESRC funded between LSE, Grantham, Leeds and Edinburgh, where actually it's about sharing best practice. The key thing about this, and my CEO puts it really wonderfully, is climate change as a team sport. And actually, even place-based action for me is part of just transition, because who knows better the needs of Reading? It's people like Elizabeth who are studying it and her team who are studying it. It's people like you, Peter, and the council who really know what the problems and where the inequalities are in Reading. And local authorities are well placed to help tackle some of these challenges. Brilliant.
I've got another very interesting one, which probably more in your sort of area, Elizabeth, and potentially Rishi. This is a question that where is it gone? So this is Graham Philpott, and Graham raises the question: how can we help organisations know what to do to address this at scale that will really make a difference? So it's surprising that when we give sessions on sustainability and talk about it to organisations, there are still many that don't know how to address it, don't know how to do the first thing. So how can we make it easier for organizations at a huge scale to be able to understand, this is what we can do. This is the tangible things we can do at a first step basis. Any thoughts on that, Elizabeth?
I assumed you were going to go to someone like Rishi for that.
I will go for Rishi as well, but I just wanted to get your thoughts as an economist. And
oh gosh, it's a really good question. I think that there's pressures on companies that don't always align. And so part of me, and Rishi, you'll know better than I. I'm not in the private sector, although I was once upon a time. But, to some extent, you can align. So a lot of it's where the shareholders put their pressure, right? So if you're focused on profit, and in the short term it looks like profit can be improved if you don't undertake those actions you've got to undertake to mitigate climate change, your profits can go down. But I think increasingly we realise that actually people care. So people care about more than the private profit, but they actually care about the social costs and benefits to society. So this is not my area to talk about, but I do feel that general public can put pressure, shareholders can put pressure, because who chooses those products and who and who's actually going to invest in those companies matters. And so I actually think it's I only managed 2 years in the private sector as a management consultant before I left, but I do think the private sector really matters. It's business, it's private sector, that we've all got to be on board together. And so I'm not answering the question, but I think it's the kind of initiatives that we're seeing from NatWest and other organisations that really say, look, we're going to align our values with what matters to the planet, and we're going to prove that by doing that, it's profitable, I guess.
Yeah, thanks, Elizabeth. And Rishi, I just want to come back to you on this, because I know, as you mentioned, NatWest are doing a lot. The government is making a lot of noise, and we've got Alok Sharma, our local MP, leading the COP discussions. And many of the other financial organisations are also incenting move towards more green investment. Yet there is still a lot of education to do, as you mentioned quite rightly. What is there more to do? Can we do more? How can we do more? How can we really get to a lot of these, as you said, the small and medium businesses in particular, and say, actually, these are the tangible things you could be doing?
And I must say, Peter has raised his hand twice to come in. I'm happy to wrap up if that's helpful. But Peter, did you want to come in first? And then I'm happy to come in next and wrap up how that works from our perspective.
Just going to say we put quite a bit of effort into the new Reading Climate Action Network website. I'll pop a link in the chat channel, but if you go there, it's designed to take you down one of two pathways, depending on whether you identify yourself as an individual or an organisation. And that gives you some, I mean, in some cases, I'll say pretty basic, but some starting points for what can I do to contribute and be part of this whole net zero ambition that Reading's declared. And it takes you through all the sort of key areas of energy, transport, and all the rest of it, that which I would recommend to anybody who's scratching their head with that sort of where do I start sort of question. But Rishi, I was contacted by a business only this morning, a Reading business, saying, "Oh, have you got any grants to help us meet your net zero ambition?" So I'm busy composing my response, which will be along the lines of, well, actually, hopefully it's your ambition rather than ours. And in a post-subsidy world, we've all got to work this out for ourselves, but you should find your bank open to and aware of the need to support clients with this agenda. So I'm hoping that's probably the right answer from your perspective.
100%. And actually, Peter, you've given exactly one of the answers in the give, because actually you've got some of the national campaigns. So, you know, whatever you think of the government's approach to date and how ambitious it is, you know, the Andrew Griffith's campaign for Race to Zero. So I point companies to that, and we've signed up to support that and try and encourage people to start. Secondly, I think I'm so glad Peter's doing this at Reading. I didn't want to put him on the spot in case they weren't, but local business improvement districts working with your local confederation of business will know your local business setup. They'll understand what your types of challenges in your business are. What are the opportunities around your building stock in Reading? I put my hands up. I don't honestly know right now, and this is where banks data will help us to understand where the challenges and what types of buildings are. What are the transportation logistical needs? You need to think about that locally. That's not something that you can centrally do. And each business has, for every business, it's always starting with buildings, transport and energy, and getting yourself informed. And you know, by being here today, people who are here today, that's how we get that information. We share that collaboration and that learning. It's all going to be a journey, but the key thing is starting. And that's absolutely it. You know, you have to start. You have to start. If you can measure your emissions already, or you can understand where you don't need to understand the precise, in front of economists, I shouldn't say you don't always need the precise data. The enemy of the good is always the perfect. So knowing which direction we need to go in. We need to halve our emissions by 2030 to be aligned with Paris. It gives you a quite good direction of travel of what you need to do on your buildings, energy and transport. And you can take action immediately. And we will be helping customers with more solutions in a more targeted way very soon. But I think COP will also energize businesses to think about this more. And I think the bit that I'm always optimistic about is that large businesses will require this in their supply chains.
Great. Tully, you've been very patient. You've got a question?
Sorry, I asked a question already on the chat. Thank you very much.
Okay, no worries. So, thank you to everyone who's asked questions. And I've seen the chat window whizzing by with lots and lots of questions. So we will get back to each and every one of you. If you asked a question, what we will do is we will take those questions and we will apportion them to the panelists and get their responses and then get back to you. So thank you very much for joining the session today. We've run out of time. I just want to share final slides. Let me do that. And thank you for joining us. And I hope you'll be able to join us next time for our next briefing, which will be in July. And that's focused particularly around well-being and around understanding the impact of the interventions that people are making around health and well-being of their staff and whether they're actually working or not. But in the meantime, we'd love you to join us. It's free, doesn't cost anything. We've got a YouTube channel, and you can follow us on the usual social media channels as well. Thank you very much for joining us today, and we look forward to seeing you next time. Take care.